Hi, Dr. Meng again, Mini Health Talk to get you health again. Today we're gonna talk about blepharospasm. So it's kind of hard for people, ordinary people to know the jargons, but if you really have the conditions, you'll learn that really quick. What it means is just like this, involuntary. Yeah, patient's eyelid spasm involuntarily. Yeah. So sometimes you think they do that on purpose, they're not, because it's involuntary. Okay, next slide, please. So what is blepharospasm? Blepharospasm is a type of focal dystonia where involuntary contraction of the muscles of the eyelid causing closure of the lids. Yeah, involuntary like that. So there shouldn't be no vision or mental affections. Okay, next slide, please. So what are the causes of blepharospasm? It's unknown in Western medicine. So if you don't know the reason, how can you treat it? So they also suspect likely genetic factors. So both of them I know. So if you know how you treat it, you can only treat the symptom. But in Chinese medicine, it considers liver and gallbladder wound from the nature of the spasm and the meridian infections. So if you know it's a liver and gallbladder wound, then you can use the liver and gallbladder wound elimination herbs to treat it. So that's a good thing about Chinese medicine. You don't understand the term really, but you can treat it. But in the Western medicine, you understand everything, but you cannot treat it. Okay. In my understanding, any kind of nerve malfunction should trace back to central nervous system. You're gonna see in my treatment plan what I think. The other thing is any kind of muscle spasm. Oh, I didn't finish it. Should be relieved by the group of herbs. Yeah, and I didn't finish that. Okay, next one, please. So acupuncture and herbal treatment. Before we talk about acupuncture and herb treatment, I'm going to talk about a Western medicine treatment that involves antispasmodic medications, Botox injections. So far, the Botox injection work on this condition is the best, but it's not a cure. Do you know why? Because they do the injections to paralyze the nerves so that you don't spasm anymore. That's horrible, right? And surgeries. Sometimes surgery just remove the muscles or weaken the nerves. However, the acupuncture and herbal medicine treatment are to eliminate the liver and gallbladder wound. Okay, next slide, please. So usually, number one, you want to calm the spirit down so that they don't nervous. Usually nervous and stress can make the matters worse. So that's why I choose do 23. And I also choose a local point, GB14, 鱼腰, 太阳, and large insect 20. So by stimulate those points that you can relax the muscles and nerves there so that you can decrease the spasm right away. Number two is hand and facial images. So you look at this hand. This is you imagine this is your head. This will be your eyes, right? So you put here in Chinese medicine, large intestine 4 controls the whole face. You use these 3 points will help a lot. Okay. So yeah, large intestine 2. I prefer 2 than 4. Yeah. And also 3 yellows. Any kind of nerve malfunction, I like to clear up the toxins. That's the function of the 3 yellows in master tones points. Stomach 36, since to relieve the whole, regulate the digestive system, and liver 3 to clear the liver wound. Okay, and I actually have a GB39 too. Yeah, GB39 to clear gallbladder wound too. Next slide, please. So since the cause of the Blepharospasm from a liver and gallbladder wound, and also any kind of nerve malfunction can be traced back to the central nervous system. That's why I use 天麻钩藤饮. Okay, 天麻钩藤is disperse liver wound. Okay, 柴葛几鸡汤 to loosen up the muscles. 五阳还五汤 is to improve the central nervous system circulation, to improve the central nerve normal functions, and 龙胆泻肝汤 to clear up the damp heat in gallbladder meridians. So I always tell my patients this is because most of them don't understand and Chinese as a dragon's gallbladder. You use dragon gallbladder to make your face look better. Is that right? Okay. Next slide, please. So I'm going to do a case study. So no matter how good you feel like your theory is, if it doesn't work on your patient, that's just garbage. Okay. But no matter how garbage your theory is, it works on a patient, that's gold. Okay. So a 33 years old Asian male came to me complaining of eyelid spasm for over 3 years. He can trace back when he was little, but the adult doesn't think that's a disease. They always think he's doing that on purpose, but he's not. The eyelid spasm interferes his work and daily activities a great deal. Botox injection help him a little, but never be able to get rid of it. Patient also experience poor sleep, cold hands and feet. That's some young deficiency inside. Mild neck pain and back pain, some eczema and pimples. Hot shower, sleep or massage. Or heat makes the spasm better. Stress, sunlight, poor sleep make the spasm worse. His tongue appears red in genital and genital areas, and the sign vein dilation is 1. Dilation is 1 usually is heart function is pretty good. Okay, slippery pulse. My diagnosis was liver and gallbladder wound. So treatments, acupuncture point, same as a general treatment. The point I mentioned above, you can go back if you really want to know what the points are. Then herbal medicine, I use 天麻钩藤饮 30 grams, 柴葛几鸡汤 20 grams, 五阳还五汤 30 grams, 龙胆泻肝汤 20 grams. Yeah, right after acupuncture treatment, patient feel about 30% better already. When he come home and he take the herbal medicine, 3 grams 3 times a day, and the next time when he see me, he said he feels 70% better after first treatment. In some days, he didn't even feel the spasms. How great it is! Just one treatment, and the patient improved 70%. He said it's way more better than the Botox injection. That's something he never experienced before. The treatment just works so effectively in such a short time. Next slide, please. So now you have some basic idea of how to treat blepharospasm. The key to successful treatment on any kind of condition is based on how well you diagnose the underlying issues, so that you can truly treat the cause of blepharospasm, not just the symptoms. So I want you to each time find the really cause of the problems and take the root out of it, so that you can help patient to improve better. Sometimes you can cure them. Next one, please. I want to thank you again for you to join me to learn the medical conditions and acupuncture and Chinese medicine treatment. If you like my program, please sum up. If you want to see more to come, please subscribe my YouTube channels. There will be a lot of videos in my channels available for you to learn, to study, to improve your health. Thank you again. We'll see you next time.